Hi, everyone. Welcome. In this wonderful podcast today, Happiness on Demand, I'm delighted to introduce you to my friend, colleague, confidant, Dr. Julie Anné Zeig. Yes, she's married to a wonderful man, Dr. Zeig, and together they make magic. The magic Julie has done for over 3 decades in the Valley in Scottsdale is breakthrough work in eating disorders and complex trauma. She's brilliant at what she does. Not only does she do that, but she's on the Faculty of Medicine at the Mayo Clinic. She's an on-air psychologist as well. And so without further ado, let's turn the microphone off to you. Let's put you in the spotlight, Julie. Talk to us about your findings in the field and how we can use your findings to make ourselves a better version of ourselves, please.
Well, thank you, dear friend and esteemed colleague. It is an honor always to be in your presence, and I'm just so excited to be here today. So you have asked me to talk about eating disorders, and especially my heart, my passion, which is the interwoven relationship between eating disorders and complex trauma. And it's difficult because we take two really complex presentations. I didn't want to use the word disorder. Presentations, eating disorders and complex trauma, and we weave them together, which clinically we see all the time. But from a treatment model perspective, there is a paucity of treatment for, and therefore we oftentimes have low rates of full recovery, which is heartbreaking and, in my opinion, ridiculous in this day and age of treatment. So it is my platform to be able to inform not only other professionals, but people who are struggling so that they have more knowledge, first of all, to know that they can and will get better if the people that they are working with really understand the comprehensive nature and help them to work through all of the issues, which is driving a maladaptive coping relationship with food. So that's a mouthful, and I apologize for that.
No, I'm eating up every word that you're saying, pardon the pun, and I'm not suffering from indigestion yet. I think it's exciting what you're talking about, because what resonated for me, Julie, is the fact that you're giving us hope. You're telling each and every one of us that we can recover from this and we can maintain this.
Absolutely. Full recovery is possible. To do that, we can't just work on surface symptoms. Yes, we need to be able to work on changing behaviors when we are in the middle of an eating disorder, but we need to be able to sustain those changes. And our current models of treatment, in my opinion, and by efficacy rates, show that we're not doing a very good job. CBT is the front runner in the treatment of eating disorders, has been from the early 1980s. There is nothing wrong with this treatment model. It's actually quite sound. However, the efficacy is about between 50 and maybe 60% effective for eating disorders. And for me, that's not enough. And I believe that because our treatment and conceptualization lens is not wide enough, especially to include the presence and resolution of complex trauma, that's why our rates of recovery are so low. And I think that's hopeful because it says if and when we include the treatment of unresolved complex trauma, people can and do get better. It's life-changing for them.
That's exciting, Julian. How do you go about doing this? Say a person comes to you and they're jaded because they've tried any and everything, as I'm pretty certain you've had that.
Oh, all the time. All the time. You bet. You bet. Well, I think first and foremost, isn't it wonderful that people recognize now, of course, that we use food or misuse food really as a primary emotional coping mechanism. I'm grateful that over the past decade, people are aware of that. And in fact, we chatted before the podcast and you said, talk about how people use food for their emotions. And I said, I will, but I want to go beyond that. Because it is not just that we reach for food in response to our emotions. But if there is unresolved complex trauma, which I'll define in a minute, people are not able to sometimes know what the emotions are that they are reaching to food to help soothe. People then, when they recognize that they're reaching for food in response to emotions, they can't tolerate or allow themselves to care for themselves in any other way. And oftentimes, when they do connect to their emotions and connect to their body through things like CBT, they get flooded if there's unresolved issues of underlying complex trauma. So we need to go beyond the awareness that people utilize food to cope emotionally. And we need to recognize when there are things that are driving things in a more complicated way, like complex trauma, and then how to treat it. So if it's okay, I'm going to talk about like what is complex trauma. Sometimes even the most seasoned clinicians don't understand the difference between, more like big T or PTSD driven trauma and complex trauma. And there is an overlap there. But complex trauma is when people have experienced multiple and interrelated experiences of trauma, which can include physical abuse or sexual abuse or emotional abuse, also physical and emotional neglect. But it happens in the early years of life. Oh, whenever I say this, I get emotional. The primary years of life, when your self is most tender and yourself is psychologically developing and unfolding. So it occurs early in life and by definition at the hands of your primary caregivers, which is typically your attachment figures. So this is going to be your parents or your grandparents or a beloved and consistent nanny. People that are supposed to be trusted that violate you in the early formative years of life. And because this happens typically in the household very early in life, there is a chronic nature to this abuse. Because if it starts when you're 3 and you can't leave home until you're 18, that's 15 years that you have to experience ongoing trauma. And therefore, your psyche has to find a way to cope. Okay? And primarily, our psyches cope by disconnecting. Okay? Disconnecting from ourself, our body self, and our emotional self as a way to somehow survive. Okay? Does that make sense? Does that make sense?
Julie, it makes me feel right now I can access feelings of intense sadness, not on my side, but on behalf of the patients I have treated. And, to hold them in that pattern and for them to know that we are authority figures, but we're not going to abuse them.
Well, absolutely. Absolutely. So the therapeutic relationship is a primary reparative opportunity to redo these early attachment traumas. And in fact, that is a core component of my strategic attachment repair therapy. We utilize this incredible honor and privilege as a clinician to be able to, in a strategic and intentional, a very complex trauma-informed way, utilize the client's current presentation and their past history, which we need to assess for, in a way that we can both respond to spontaneous opportunities in the therapeutic sessions and relationship, and we can actually artfully craft and create reparative opportunities to redo these primary attachments that got so disrupted. In my opinion, We cannot ask a client to connect to their body or connect to their emotions if it is, number one, not extraordinarily safe to do so, and that they have learned tools to be able to manage that attachment. And we can give them cognitive tools, but in the absence of unresolved complex trauma, or in the presence of unresolved complex trauma, they will get flooded by trauma and they will disconnect, which deems most cognitive behavioral models ineffective. Now, I'm saying this in a somewhat rushed and somewhat simplified manner because I'm aware of the paucity of time that we have. This could be and is a 6-hour workshop presentation that I often train clinicians in, but it is a core component that is so absent from our current models of treatment. We know that there is comorbidity between all eating disorders and trauma, especially complex trauma. But if you look at models of treatment for eating disorders and models of treatment for trauma, there is not one model, to my awareness, that integrates the two. And that's what I'm offering. That's what I am wanting and needing to change, because in my 30 plus years, that's what brings people to full and lasting recovery. And it's time that we do a better job in our field. So, yeah. Can you tell I have a heart for this area?
I really, I love your passion because it mirrors my passion in my clinical work. And one of the things that our listeners aren't aware of, but I am, because I know this intuitively about you and I, is pacing. With a CBT model, you go chop, chop, chop. With this model, you really are waiting and holding, in a metaphorical way, the person who we feel humbled to come into this relationship. And for me, that means I need to wait and hold and wait.
Yeah. You can tell you're an extraordinarily talented and attuned clinician. And it's funny, as I've offered this model, I've really struggled with calling it a model because it has to be idiosyncratic. We have to be attuned. We have to adjust. And I actually like the word framework much better. It is a conceptual lens that is broader and brings in many different components of necessary repair. And then there are ways to do that. I do have my own style, and there are components of that I think are really important. But a model, in my opinion, is something that we impose on all clients. And I think we need to have a framework. We need to have an understanding and a roadmap for what we believe creates repair and healing and resolution, and in this case, full recovery. And then we need to adjust it as we sit across from a client that we are pacing with and attuned with and working to tailor to their own individual language. In fact, I'm presenting on this very thing in Lucca, Italy next week. And so it really is, it brings in so many beautifully complicated and complex models that can seem a little bit overwhelming to a clinician, but it's necessary in the complexity of this presentation of the client and what they're struggling with. And the hope in this is when we do this and we do it well, clients are able to get better. I will never accept a client sitting across from me saying, I know that I can't get fully better. I've heard this myth that says I'll never be able to have this eating disordered mindset ever not be part of my life. And I always look to them and I say, you know what? one day we're going to be sitting across from each other and we're going to be reflecting back on this day, and we're going to be smiling and laughing with each other when you are fully recovered and you have complete freedom from the prison of your disordered eating and your disordered relationship with self. So I have, that is where my passion comes from. Everyone deserves to live a life where they are free of really the obsessive compulsive prison that are eating disorders. And it's possible. I promise you. I know it.
Well, I think that to support your comment, it's not that you're just promising this to us, but you have clinical data to support what you're saying. And I think all of us listening to you need to tune into that. What Julie is saying is she's presenting us with a framework, not a formula. And there's a very big difference between framework and formula. In my work, I like to say, I'm going to present you with a scaffold. And we could put things on a scaffold, but I like using that because it causes me to be humble as well and to understand it's a scaffold. And based on your time, you will tell me what we're going to put and what we're going to take off that scaffold.
Yeah. No, it's really true. We need to walk through treatment with our clients, and our clients are the ones that have the answers within themselves. And, when I will say that, sometimes other clinicians will scoff and they say, yeah, but how about the disordered aspect of it? They're not seeing things accurately. There's a distortion. And I say, yes, there is an eating disordered part, but we still need to tap into the psyche of the individual sitting across from us. We need to understand their story. We need to be attuned to their present, current interpersonal response to us, their reaction to their own emotional states. Do they get dysregulated or, overwhelmed or dissociative in response to the different things that we are offering? And it is our job to have this expansive framework that is also strategic and intentional. It's not just willy-nilly sitting across from a client. We have a roadmap, but that roadmap is always going to be walked a little bit differently because the journeyers, the patient and the therapist, are always going to be new and nuanced, even though the path is well trodden. And isn't that the art of psychotherapy, right? Isn't that the privilege that we walk every day with our clients? So I'm really excited to be offering, my expanded framework. And it's not the only one. I want other people to continue to offer their expanded frameworks because the current ones are sound, but they're not serving our clients well enough.
Well, I think the word that comes up right now is restorative.
Mm-hmm, mm-hmm.
Because that's what you're doing.
Well, you tell me, what is your association with that word, restorative? I agree, but I'm curious.
Because we're just not saying you have X, Y, and Z, therefore this is the formula. You're saying we're going with restoration, and restoring means I want to take the strength that was there that you're telling me you don't have, and intuitively bring that into the present with your permission and with your direction. See, I really liked what you said when you said, well, therapists will say to you, Julie, really? But we know better. I hate that with a passion. How dare they say they know better? Do we know better? Really?
I think anybody that is adamant that their way is the only right way, is protecting some ego need because gosh, isn't it the wise person that listens and learns from others as well as from within themselves? We don't have all of the answers. We want to listen to other people that have had other experiences, and then we want to run it through ourselves, and we want to add our own piece. But if we need to make our piece the only right way, doesn't that give us a lot of false negatives, right? I mean, it takes a village. It takes a universe to help treat somebody with an eating disorder. And when we are humble enough to draw from lots of different perspectives, we bring our patient, who is the one that is supposed to be benefiting from our frameworks, to a life that they deserve. So we have to be open-minded. We want to continue to develop. I don't know that any of us has the one right answer, and I hope that we keep offering as we learn and revising our perspectives as we learn, because isn't that what the process of life is all about? I think it is.
But the thing that you're talking about is sustainability, which is giving our audience right now a lot of hope. And I thank you for that. Because you started by talking about where we fall short. And now you're talking about the ability to sustain changes for a lifetime. I mean, who wouldn't want that?
Absolutely. And, you know, I have to talk about what I see as some of the limitations in our current subfield of eating disorders in order to encourage many, many others and hopefully open the path, the doorway for others to step through along with myself at offering new frameworks. Because again, our clients deserve better. And it is our task, not just as psychologists or psychiatrists or therapists, but as human beings, right? To use our own perspective and possibly our own purpose to help others. That to me is what life is all about. And this is one way that my heart is doing this with the people that I serve. So, yeah.
So a quick question before you leave. Are there some takeaways you'd like to share with our audience?
Well, I think the first takeaway is if you are struggling, please know it's not you. There is nothing wrong with you. You're not doing anything wrong. Okay. Perhaps you need to find somebody that is more specialized or can offer something that is more helpful. Don't give up and believe that it's yourself. I say that because so many of our clients, especially in this area, are filled with shame and lack of self-worth. And so if they're struggling, they're going to look at themselves instead of maybe I'm not being offered the right treatment modality or it's not the right therapeutic fit. You can get better. I promise you that. That's just not my heart. That is from decades of experience and seeing many people fully recover. I think the other takeaway is that we have to not only recognize, which we're doing now, that eating disorders are impacted by unresolved underlying complex trauma, but we need to start offering models of treatment or frameworks of treatment for how to fully repair this. It's imperative if we are to get long and sustaining change. And what would be the third takeaway? I think the third takeaway is that everybody has a story. And it has a physical story, and it has an emotional story, and it contributes to sometimes what allows us to be joyful in the here and now, and also what brings us to struggle. We have to look at that. The past is not the past, and then it's done. It can be once it's resolved, but all too often the past is brought into the future, and it obstructs us from becoming who and what we want to be. So it's okay to look back towards resolving because we want to take back our life. We want to be fully healed and empowered so we can have the life that we deserved before whatever happened to us. So don't be afraid to put the time into that. It will serve you well. And in the long run, it will help you to struggle, in my opinion, the shortest amount of time because you'll have a more effective mode of really healing yourself and what is creating your current struggles, at least in the area of eating disorders and complex trauma. I think that this is true in many, many areas of disorder, but I'm speaking from my area of expertise. So don't be afraid to put in the time and the work. It will serve you well, and you can have the life that you deserve and want.
And to add to that, I guess what resonates for me is the idea that we look at the past and think it's all negative. And sometimes we can harvest from the past some strengths to move forward with. So that's something that I think Julie's also sharing with us. And the underlying theme for me is your ability, our ability, to practice self-compassion.
Yes. Well, part of the work oftentimes is helping our clients in an authentic way to get to a space of self-compassion. Mm-hmm. It's one thing that they can know that they're supposed to not say negative things to them. They're supposed to know all this, but how can we artfully, as therapists, know history, tailor this to their specific psychological self and help them to eventually repair, reconcile, sometimes forgive whatever it is that most of the time they are unjustly accusing themselves of, and approach themselves with the compassion that we're all deserving of. We are all imperfectly human and error and have parts of ourselves and behaviors all the time that we could feel shameful for. We have to understand, and we have to ultimately embrace ourselves with compassion. And that is within the relationship with yourself. You can experience that with others, but until you can experience that within yourself, you can not really truly heal and move forward. There's good news and bad news with that, right? We have to be the one that heals ourselves, and we get to be the ones that direct whether or not we're able to heal. Isn't that fantastic?
It is. And I'd like to thank you, Julie, for spending time with us. I know you're very busy, but I'm sure we've all gained a lot from your insight, and above all, from who you are. So if you like this podcast, share it with friends, please. You can get a hold of Dr. Anné Zeig on her email. You can get a hold of me if you've got any questions as well. So until next time, bye for now.
Thank you for joining this discussion on happiness. We hope this helps to inspire you to lead a more joyful life. To dive deeper into the subject of happiness, be sure to check out Dr. Nihal's book, Happy is the New Healthy, available as an ebook or hardcover. For additional resources, visit our website at drnihal.com. Until next time, stay happy.